So we're going to do some rotations for the hip here. So for people with small to medium-sized legs, I can take and push them up here. If they have big legs that are more heavy than I enjoy pushing, I'm just like, let's bring your knee up to your chest. Or I'll tell them, bring your knee up to your chest. And they can bring it up, and that's just fine. There's cream on Janice's leg here, so I'm leaving the towel here to cut the cream. If I go hand on leg with cream, it's a jerkier movement. Okay, so right now I'm going in a little circle, and when I push a little bit further in the circle, I'm able to access her SI joint. And it goes out like that. Notice how my body is back here, my arm straightens, and I stay away from her. In other words, I don't come up here and work there where all my joints are crooked or bent. Rather, I stay out here where I'm able to straighten my arm out and keep better control for her. And then I'm taking her knee over outside her belly towards her shoulder. There. Let's come back and do this rotating movement. And now I'm going to do a spinal twist. Put your hand here. Okay, so I have my downhill hand under the crook of her knee. And this is optional, but I like to put my leg up here on the table to give better support. And I'm going to take her hip and rotate it. And I put my hand right here on her hip bone, so that her iliac bone is right there. And I can take and help guide the movement by having my hand there. And now I'm going to slide this hand under her back, and it's going to, take a look right there, it's going to be under her back, right beside her backbone, doing little compression tractions like I'm doing here on my arm. But it's actually going to be on the back. Take a look here on my back, right beside the backbone, going like this. So I slide my hand under her back and do little compression tractions right along the edge of the spine, up as far as it's comfortable to go. Then come back and take her across. Let's do some more compression traction under the spine. Come back out and take her across. And she goes a little bit further. Oftentimes I will come all the way up onto the table. So when I'm on the table, I can direct pressure back down this way. I can take this hand, slide it under the back, and get a little more motion. Sometimes I put my hand all the way up on her shoulder here. The important thing here is to keep the slack out. You don't want the leg down here. You want to take it here where you've taken the slack out, and then move her around here. Now, she goes pretty well here. Some people it's not that easy, and one way to help that is to work on the psoas muscle and the iliacus muscle.